Welcome to the Menopause Hour, your go-to source for answers to your burning menopause questions, the ones you won't get from your OBGYN. Brought to you by Winona, where menopause care is made easy. Download our free Winona community app where thousands of women connect and access exclusive content, expert-led courses, exciting events, and more. It's time to take the guesswork out of your hormonal journey.
Hello, everyone, and welcome to another one of our Ask the Experts live doctor Q&A. So glad you all are here. So sorry we are starting a few minutes late, but so glad that you all stuck around. Now, Dr. Kat will be with us in just a minute. She's had a really busy 24 hours finishing a shift at a hospital, so she'll be here in just a minute. But we're going to go ahead and get things started. I'm going to give kind of the spiel, give the introductions, but just wanted to say again, thank you guys so much for taking the time out of your busy schedules. I know it can be really hard to kind of find that time really to set it aside, to take the time for yourself, but we're so glad that you are here today. I always forget to introduce myself on these. I'm Maddie. I am the community manager here at Winona. You may have seen me kind of in the app. Maybe you've seen me posting something, commenting on your post. If you haven't seen me, I've probably seen you. I am typically always kind of reading the posts, and I love hearing your all stories. I love seeing you all encourage each other. And I also I think it's so great to see, when someone is having a problem or an issue that you all kind of just jump around and encourage. I think that is so much the power of Winona's community, whether that's in the Winona app, which obviously you all know since you're here today, or whether though that's in the Facebook group is also a really, really great community area for that as well. So however you found your way here tonight, so glad that you guys are here. Now, I'd love to also know a little bit maybe about where you all are calling in from. I always think it's so fun because we have such a nationwide, community that I just feel like there's people that always are calling in from everywhere. Judy says, hi from Judy. Judy, so good to see you. So glad you're here today. So if you want to drop where you're calling in from, feel free to put it in the chat. If you're not feeling like that, no worries. I'm currently in Dallas, Texas, actually. We have a Winona in-person event happening this Saturday. So I am here to help facilitate that. If you happen to be in Dallas, we'd love to see you there this Saturday. It's a completely free event. We're going to have yoga. We're going to have panels. We're going to have a light lunch, refreshments. We're going to have giveaways. It's going to be a great, great time. Dawn says hello from Northern New York. Hi, Dawn. Nicole is Northern Colorado. I love it. See, that's what I'm saying. There's so many people from so many different places. Phoenixville, Pennsylvania. Okay. Yes. Love that, Judy. This is amazing. So great to see you all throwing in your places. That's so great. Cheryl, hey Cheryl. Okay, you're from Nevada. Oh, see this? Oh my gosh, we're really all across the country right now. I love that. I think it's so cool that, we all can come together, yet, we're all having very similar experiences, and just all are here kind of for answers. Yeah, we have a Miami, Florida. Hey Shannon, so glad you guys are here. So just kind of a little bit of a rundown of how these work. If you've never been to one, if you've been to one before, welcome back. We're so glad you're back. A little secret, you can come to as many of these as you want. I think that's one of the really cool things about these events. And, this is the place to ask all of your medical questions. I know sometimes in our groups, we try to shy away sometimes from medical questions directly when you're posting, just because we don't always have a doctor reviewing those posts. And we're really at Winona want to be really cautious about your safety. But the cool thing is, like Dr. Kat, who's just joining, we'll give her a second, we can answer all of your medical questions here because we have a real live doctor on the call. Hey, Dr. Kat, how's it going?
Hi, good. Thank you for your patience and waiting for me to get on.
No worries. We were just kind of throwing all where we're at in the chat, and we've got people from all over tonight. So that's always super exciting.
Easy. Very cool. Let me open that window. I want to see where everyone's from.
I know. That's what I was just saying too. And I was telling them how we have the Winona event this Saturday. So that's super exciting. But really exciting on that end. But just
Judy's from Phoenixville, PA, which is 20 minutes from where I live. That's not far from here at all.
Oh my gosh. That's so exciting. Isn't that fun when you can kind of make those connections on that way? Absolutely. Well, just to I was finishing giving people some instructions, but just so you all know, we're going to go ahead and start to get into answering your questions. It does usually get a little bit crazy because there's always a ton of questions. So I would recommend going ahead and throwing your questions in the chat now. They can be on anything you have a question about. Go ahead and throw them in, and Dr. Kat will answer them in a little bit. If you don't really know a question to ask, you can kind of listen into what other questions people might have. But some good ones might revolve around your HRT treatment, what DHEA is, how to contact your doctor. Anything along those lines is great. There's no wrong questions. I know people always say that, but it's true. We're here to answer all your questions. But Dr. Kat, I don't know if you want to introduce yourself in case, I know there's probably some people on here who've never been to one of these before. So give a little bit about who you are, and then we can jump into things.
Sure. So I'm Dr. Kat Brown. Kat short for Kathleen. I'm a board certified OBGYN, and I'm in the state of Pennsylvania. I became our medical director at Winona last year. Maybe it was 2 years ago now. I'm losing track now, but I've been doing it now since 2021. Taking care of patients in the state of Pennsylvania first, and then I had it in Florida and Hawaii and Michigan. I used to be in the Army. I was a servant for 12 years, so I have moved around a little bit in my career. And now I work in a hospital delivering babies part-time. And also I take care of patients with Winona, women's UA and telemedicine as well. And women's health has been my love. It's what I've devoted my career to. And I think it's so very important for women to learn as much as they can about their bodies. Just a little bit more about me. One of the things I really, really love to do is to garden. And this week, the reason why I was late getting on, this week I'm running a plant sale at my kids' school. And so I was outside all day teaching kids about plants. And then we had a community event tonight where people were coming. All the proceeds that we make at this plant sale all go to the Home and School Association, paying for school trips and all kinds of stuff for students, supplies that they need, teachers need. But nothing else. All right. So I was quickly running home and getting changed, and I was covered in dirt. So I had to put the tub in the shower, which is why my hair is still wet. Because there was really no time to dry it. I was like, oh no, it's almost 8 o'clock. I gotta hop on it. So
No, I mean, I feel like that's what we always say, right? That's one thing I love about Winona is that we are very authentic and we're all about real life here, which I think is so important when we're talking about midlife and perimenopause and menopause. So I think that's amazing. I love we're all doing life here together. I think that's great. Absolutely. Well, it looks like we've got a couple questions that we can jump into. Let's jump in. Our first one tonight is from Gina. And Gina says, lots of conflicting information about how long someone can be on HRT. Any research or opinion on this? And then she has a second part of the question, which is there such a thing as too high a dose of estrogen or progesterone, or is there a typical maintenance dose after several years? So we can do one part, 2 parts, or throw them all together.
I mean, really a lot of the answer to this is that it's patient specific, right? So years ago when I was in training, learning how to be an OBGYN physician, I used to tell patients that, you should want the lowest dose for the shortest duration possible to get you over the hump. But now the research is showing that there's actually added health benefits as far as preventive health and staying on estrogen replacement therapy. And so, the theories are changing because we know that women need estrogen to protect their bones against osteoporosis, osteopenia, but also to protect their heart. Really, the estrogen helps to keep our blood vessels that feed the heart more elastic and more open to help keep feeding those coronary arteries. So when women lose estrogen, our heart disease risk goes up almost exponentially. So a lot of women decide to stay on it more long-term for the longevity benefits and those health benefits as well. But every patient has to weigh the risks and benefits of any medication, right? There's no medication out there in the world that's without risk. So it's going to depend on your individual situation, your health history, what other medications you're on. If something changes in your health, we might need to reevaluate to see, is hormone therapy still a good thing and still a safe thing for you? Because if anything, no matter what you're treating and no matter what the medication's for, your benefits should outweigh your risks, right? Otherwise, why do it? Why put yourself at risk? And as far as the second part of the question, Is there too high of a dose? Yes. For each individual patient, there can be too high of a dose. We know that based on what side effect profile you should develop when you're taking that medication. So that's why we generally start low and we kind of titrate up until we find the sweet spot of getting your symptoms under control. We don't want to start high and start at a high dose and then you get a lot of side effects and a lot of issues. And so it's not so much that there's like an age-dependent dose. If you're a certain point in your midlife transition, like your perimenopausal or your menopausal or 5 years after menopause, the dose doesn't change based on where you are in that timeline. It's more about you as an individual, and we want to give you enough of a dose that's going to help your symptoms and help you feel your best, while also balancing not giving you too many side effects. So, there's not a magic number that's right there for everyone. Everyone with TV, their bodies all respond to. And that's why really hormone therapy should be personalized to you. And that's something we believe very strongly in. It's the same protocol.
Absolutely. Absolutely. And it looks like our next question tonight is from Nicole. And Nicole says, I've seen a lot of negative discourse regarding the DHEA supplements. Can you talk about why we might need DHEA?
Well, the reason we use DHEA is to help boost your testosterone naturally. So testosterone, is something that women may need in neglect, especially during this transition. It helps with many things, but it's a controlled substance in many states. And so being a telemedicine platform, we have to be careful about what we can and cannot prescribe via asynchronous telemedicine. So the reason we use the DHEA is that it's a gentle way to raise your testosterone levels without prescribing something that's considered a controlled substance. So what DHEA is a precursor hormone, and it's not just a supplement, it's a hormone that our body makes naturally. So, and when our body breaks down this precursor hormone, it breaks it down into estrogen and testosterone. So it's a gentle way of boosting those levels safely. And you might hear negative things about DHEA because it is abused out there. People take very high doses of it, in the weightlifting community, bodybuilding community. Sometimes they'll use testosterone, but also DHEA as a high doses to be able to perform better, run faster, lift more, all that kind of stuff. And so it's considered to be like a performance-enhancing drug at high doses. Athletes could use it too. So that's why there's a lot of negative opinions about it. And sometimes if you go searching on the internet, you have to be very careful about your sources because they'll tell you a lot of those negative things. They're not talking about the low doses that we're using. We're never going to prescribe you something that's too hard. It's an option.
Absolutely. And it looks like our next question tonight is from Lisa. And Lisa says, I've been on HRT for about a year now, and I still struggle with energy levels. What do you suggest I try for this?
Well, it all depends on what it is that you're taking. But most of the time in my experience, when energy levels really suffer, it can come back to the quality of your sleep too. So many of us in midlife going through this transition where hormones are fluctuating so much, our sleep is one of the first things that gets affected very negatively. So we might have trouble falling asleep or staying asleep. Many women are getting up multiple times a night with night sweats or getting up to pee. When your sleep quality is not good, or maybe you're one of those people that thinks you won't function on 5 hours of sleep. I used to feel like that. But now we need so much more of anything in order to really get that restorative sleep so that we can be our best selves the next day. But if there's other things in your life, sometimes taking a healthy vitamin or vitamins to help with that energy level. The DHEA that we mentioned earlier can actually really help combat fatigue for a lot of patients too. And so if you're not on that might be a good addition to add to your hormone therapy. So there's lots of different things out there. B vitamins are very good for energy, but I always encourage women to look at their routine and to look at their nutrition, look at their sleep. What can you do behaviorally in your day-to-day life that can optimize your energy levels? There's probably things that you could tweak better. Maybe adding an extra hour in the night and try to shoot for the 8 hours a night. Magic number. It's amazing how much better we'll feel and how much more energizing. So we're doing good, restful, and sleep.
Absolutely. And it looks like we've got a couple people typing, but just while we're giving them a chance. Oh, there's one actually. Nicole, it's like, that's perfect timing, Nicole. That was great. She says, is there an ideal time of day to take the DHEA?
I usually recommend that patients take it in the morning because that's when our body naturally releases the DHEA. But the real answer is whenever you can remember to take it regularly, right? So it all depends on your routine, right? So if you're someone who takes other medications in the morning and it's really easy to just add one more in, that might be good for your routine to do that. I've had other patients that actually prefer taking it in the afternoon, other patients that prefer taking it at night. But normally I usually recommend starting it in the morning. Not on an empty stomach typically. So, I think a lot of people have kind of veered away from eating a good breakfast or, trying to skip things in the morning. Many of us grab coffee and then we're on the go. But it's really important to start your day with some good protein and have some kind of nutrition meal in the morning to start your day. And that's when you'll take your DHEA to that will be.
Absolutely. And just while we're on the topic as well, I bet some people might be curious about this. Is there an ideal time of day to take your HRT, or how does that work with your DHEA?
Yeah, it depends on what form of HRT that you're taking, right? So if someone's on oral pills of estrogen and progesterone, that means you can separate them out. Estrogen can be an energizing hormone for some patients too. So sometimes taking your estrogen pill in the morning would be good. But for most women that are going to take the progesterone, we usually recommend taking that at night because it can make you drowsy. But if you're on the combination cream or compounded cream that has both the estrogen and progesterone in it, most women will start out using that at night because they get more restful sleep when they use it at night and they quiet and heaving. Whereas if you're using the patch, if you're using an estrogen patch, it doesn't really matter what time of day you put it on because the patch is staying on for half the week. And then midweek, you're going to change it. And that's harder to remember, I think, for a lot of patients. So I actually use the patch and I actually include it on my Google Calendar. I have a reminder. And then how late today, I set the schedule, and I move it. But I have to do that because with 2 jobs and 3 kids, we are balancing so many things. And so for so many women in midlife, you're taking care of kids, but you might be also taking care of aged parents and juggling so many things as women. You have to try to make your life as easy as possible. So I'm setting reminders, not tucking it away and as a habit, but leaving it somewhere that you're going to see it every day because it takes a couple weeks to get into the habit.
Absolutely. And Dr. Kat, I'm wondering, can you tell us a little bit about what it looks like from kind of when you're onboarding for your DHEA through kind of maybe your first 10 weeks? I feel we often have a lot of questions about kind of what that beginning experience looks like for someone who's maybe just kind of getting into taking HRT or DHEA.
Yeah. I think the big thing, once you get the onboarding done, and one of our physicians reviews your chart, it goes over your health history to make sure that you're a safe candidate for the medication. Typically, if we have questions, we might message you, or maybe you have questions before we prescribe, and you might go back and forth a little bit. If everything gets answered and we're ready to proceed, then it's pretty quick that we order the medication. It gets processed by our pharmacy and it's sent out to you via the U.S. mail. So it usually gets to you within a week. The biggest thing I think to focus on when you're first starting medication is just to get familiar with taking it. How are you using it? What time of day are you going to put it into your routine? And then you really want to try to stick to that. And you want to try to also optimize how much water you're drinking, how your nutrition is. There's all these other things that we need to do because the medication alone is not going to do everything you need to make us feel like our best self. But I think that initially when you're first starting any medication, there's some adjustment period. So often, it takes your body getting used to medication. So you want to try to stick it to the routine, at least in a few weeks before you really start scrutinizing it and trying to think about, is this good? Is it not? I think many of us want to feel better right away and we want to start to see a difference within a couple of days. And that's just not practical when we're taking hormones. We need to give your body a chance to get on your levels to a good level body before we really evaluate it to see if it's really working for you or not. Many women, when they're first starting hormone therapy, can feel some gentle side effects in the beginning, some GI changes, they might feel more bloated. They might notice some changes that way. Many women notice that their sleep improves or when they start hormone therapy, they start to feel like they're sleeping better, which is a great thing. So when you start sleeping better, our stress levels go down. Our body's able to bounce back and be more resilient. We're able to deal with things a lot better. And so those are things to kind of look out for at the beginning. But the DHEA, on the other hand, when you first start that, same thing. You want to get in the routine of taking it every day. finding what time works for you, usually in the morning, like you mentioned. That's what I usually recommend. Many women can start noticing changes in their skin and hair as the DHEA is getting into their system. Like you might notice your scalp might be a little bit more oily. Sometimes your skin might be a little bit more oily as you're getting DHEA on board. Some women could experience liver hormones are fluctuating too. That's one of the not so pleasant symptoms of perimenopause and menopause is the skin changes. But DHEA can trigger acne dislocations, but it's usually transitory. Like it's not to last forever. It's one of those things that your body is just acclimated to the change in hormone levels in your body, and then it'll get better. So those are things to watch out for.
Absolutely. And I see that, Dawn says, I think in regard to like what you were saying before, but was saying, I've been using Apple's Health app medication reminder tool. And I think that's great, Dawn. Yeah.
Any tools you can use, to just make your life easier and to remind yourself of things. It's so easy for us to do that.
Absolutely. And Dr. Kat, I think one thing that I actually saw something recently about this that I don't know if I've had a question about this in a while, but I remember we used to have them a lot, which I feel like could be good to touch on real quick. But I did recently see that like a company was starting some like hormone testing and kind of like what that looks like. But I'd love to get like your take on kind of how that fits into the HRT kind of journey and what kind of you think about that on that end.
Yeah, I think that there are a lot of people out there offering hormone testing, recommending it, and telling people that they can really find your levels and fine tune your therapy. But really, the real answer is that you really don't need testing. Our hormone levels fluctuate so much throughout the course of one day and from day to day that it's not a reliable way to know how best to treat you. And so it's one of those things that, if you ask any menopause specialist, somebody that is trained in really menopausal patients, they're never going to make you get hormone testing before starting treatment. So, that's the American College of OBGYN doesn't recommend it. Menopause Society doesn't recommend it. All the international menopause societies outside the U.S. don't recommend routine hormone testing. There's a lot of people out there trying to do that. And it's just it doesn't help me as your doctor to know how best to treat you. I can look at your symptom diary, and that's actually much more helpful to know like what it is that we need. And honestly, trying the treatment, and really getting the hormone therapy fine-tuned for you is sometimes trial and error. It's like trying on clothes. That's the best way to describe it. Every woman's unique, right? If we all go to the store and want to get a pair of jeans, we're all going to want to grab a different style, a different cut. What it's the flared leg or the straight or the whatever, medication's the same way, and it's one of those things that we have to try it and see how you respond, tweak the dose until we get your system permanently whole. A hormone test, unless you got hormone testing done several times a day, many days in a row, which who wants to get blood drawn that frequently? Feel like a pinfiction. That's really the only way that we would globally get enough information. And that's just not practical in our day-to-day lives to get blood draws on a daily basis. That's really the only way that we'd be able to like trend it and look at things. And it's just not something that we would write. Oh, you're muted, Maddie.
Sorry about that.
Because I think you muted it so that we wouldn't hear it. He's talking.
My bad. So Gina has a question. She says, I think you answered this, but I think the question's a little bit different than what you answered. So I'll ask it as well, but she's wondering, do hormone levels still fluctuate well on HRT or remain relatively level?
Yeah, when you're still actively kind of in the transition, like if you're starting HRT in perimenopause and you're continuing to go through your own natural aging process and your ovaries are still changing, yes, your internal hormones are still fluctuating and still changing. But what the hormone therapy is doing for you is adding in a steady state dose to kind of help keep your body more level. So internally, as your ovaries are continuing their aging process and our eggs are dying off and our reproductive potential is declining until we get that final period of menopause, those hormone changes are still happening internally. So you might notice if you start hormone therapy in perimenopause, like in your mid-40s, as you continue to get older and you get into your early 50s, your dosage needs might change. And that is reliant upon like what's happening with your body. So yes, they still can change. But then once we have completed menopause and once we are kind of out of that window, like you've gone full 12 months without a period and you're officially postmenopausal, our internal hormones are pretty stable after that. And so most of those men, your dose won't need to change very much.
Absolutely. And we have a question next from Shannon. And Shannon says, I haven't started any meds yet, but plan to. She says, I just started getting severe hot flashes and night sweats in January of this year. There's many times throughout the day and constantly at night. This symptom is what made me realize I'm in peri or menopause. I just turned 49. So my question is, how often should we have our hormones tested? Or is there such a thing as having your hormones balanced?
Yeah, so I don't know if Shannon heard our last talk about the hormone testing, but no, we don't recommend getting hormones tested. Really, the only hormone testing that a woman should ever get is if she's on testosterone therapy. That's one level that you should be following if you're taking testosterone, but we don't prescribe that at the Milna. So it's not recommended to get your estrogen levels or progesterone levels or your stimulating hormone levels tested. It's just not helpful for us. It doesn't help us to guide your treatment. It doesn't, help us to know like how you're responding. It's best to follow your symptoms as they heal. And there's a lot of people out there that promise to balance hormones. In fact, there's whole clinics popping up. I've seen them around. Be balanced, and all these different things that try to do like hormone testing and trying to balance your hormones. There's no perfect balance that's universal for every woman out there. Like I said earlier in the call tonight, it's personalized experience for every woman. And so, it's going to be about finding how you feel best. Like, what's the cocktail of medication that helps you feel best? And how can we balance that with your lifestyle changes? Because, perimenopause and midlife should not be like this negative thing. It should be like an impetus to really do the best thing you can for your body. And it should be kind of a push for us to take care of ourselves better for the rest of our life, I think. And so that's something that, balancing hormone therapy with nutrition, with the optimizing your sleep, making sure you're getting daily, opportunities for exercise and movement, weight training, all these things to help to be our happiest selves is important.
Absolutely. Yeah. And Dina, kind of on that note, she says, great answer about hormone testing. She says it's complicated. Treatment should be individualized, tailored to our symptoms. It's so exciting. Women have options opening up. It's about time.
Yes.
Yeah. That is, yes. I always feel so encouraged seeing all the conversations happening in the Winona app and in our Facebook group, just because I think that conversations around this have been so taboo or so polarized. And it's so great to be able to have an open dialogue, I think, about it for sure. Which is also why I think that events like this, Dr. Kat, and you taking your time as well to kind of dive into these answers is just really so important.
I'm really glad women are taking advantage and learning more.
Absolutely. And it looks like we do have a question from Dawn. Dawn says, since starting the estrogen patch about 7 weeks ago, it seems my sleep is deeper, but I am still waking up at 2 to 3 a.m. to pee. She says, I felt more rested the last few weeks. And then she says, are women generally just saying they're feeling more rested? Is it only because the hot flashes are reduced or other ways?
Well, I think overall, the hormone therapy helps your rest to be more, your sleep could be more restful. It does reduce night sweats and hot flashes because often when we're waking up in the middle of the night, sometimes we don't know what it is that's waking us up. Is it a night sweat that then makes us wake up and then we're awake and alert and then our bladder says, oh, okay, it's meant to pee. What comes first, the chicken or the egg? Or is your bladder getting full and then you have to pee and then you get up? It's one of those things it's like when you're half asleep and in that dream state, it's hard to know what it is that's actually triggering you to wake up. But, if you're still waking up at 2 or 3 a.m. to pee, I always recommend looking at what your liquid intake is for the day. And often if someone's waking up, several times during the night, it's not uncommon for a woman to get up at least once a night to eat, and I do. But if you're happy to get up 2, 3, 4 times a night, then a little too much. And so you might have to start dialing back on how much you're drinking in the evening. I mean, if you're depending on how long it takes things to get through your body, if you're still drinking lots of liquids by 8, 9, 10 o'clock, then you're likely to gonna have to need to pee just because your body only has so much capacity. Just have to get up and empty it. But I think a lot of women feel more rested when they take estrogen. Just overall, it's reducing our stress hormone levels. It's helping us to get deeper sleep and more quality sleep. The estrogen actually works in our brain too, on our neurotransmitters. So it makes sense that our brain would be more rested as well. Because we don't sleep as well when estrogen is aged out of our system. And so it definitely makes a housing effect.
Absolutely. And we have a question from Gina. And Gina says, I recently tried a lower estrogen dose of body cream due to some breast tenderness. She says, my physician expressed that I was on a pretty high dosage for maintenance, and my symptoms returned. I just started back on the original dosage. I guess I am just wondering if the 7.5 dose does seem high 5 years post-menopause.
It's not necessarily high for, overall for everybody. I think it's patient dependent, and it's based on what your body needs. So without really knowing your symptom profile, your body type, it's hard to comment on a specific dose. It's more about how your body responds. And like I mentioned earlier, it's all about the risks and benefits, right? So if that's the dose that works for you and you feel your best on it, then we contribute it. And if you're starting to get side effects, then we start to dial back the dose because, sometimes if you have breast tenderness, that's a common symptom that many women get early on when they first start hormones, but it generally goes away. But if the breast tenderness becomes persistent, it can be a sign that your estrogen dose might be too high. So that's often a reason why the docs will decrease that dose for you. But it's one of those things that if you're concerned and if you're one of our patients, you can always reach out to the doctor. And that's one thing that's different about our platform compared to a lot of the other telemedicine platforms that are out there. And we're so happy that there are other, platforms out there and other competitors out there, because the more hormone therapy that's available for women, the better. But what's different about ours is that ours is asynchronous, meaning that if you're getting up at sort of random morning to pee and you want to reach out to your window doc, you can just get online and send us a message. And then as soon as we're awake and we're looking at the message, we can respond to you. Whereas many of the other sites, you have to actually schedule an appointment and actually have a live video visit, with the doctor. And so it's the same as waiting to make an appointment in the office and needing some time and only having a fixed amount of time to get your questions answered, whereas you can message our doctors.
Absolutely. And we have a question next from Shannon. And Shannon says, I had a full hysterectomy in July 2024. She says, how does this impact HRT meds? I was told I would probably not need progesterone due to not having a uterus. Is that correct?
That is correct. Yeah. So the main purpose of the progesterone in hormone therapy is to really prevent that uterine lining from overgrowing and being a risk for uterine development. There are some benefits to progesterone and helping some symptoms, but really that's the main role that it serves. So when you don't have a uterus, you don't need to take that part. And actually more research, we used to have such a fear, and many women weren't using hormone therapy years ago because of fear of breast cancer. And that's something that, we've kind of debunked a little bit because people kind of took it out of proportion, thought the risk was much higher than it was. But really, when you look at the components of hormone therapy, if you're able to take estrogen alone, it actually can reduce your risk for breast cancer. It's the combination of the two, of estrogen and progesterone, that can slightly increase, but really not significantly. So yeah, if you don't have the uterus, you don't need the progesterone.
Absolutely. Well, Dr. Kat, we may have someone typing, but at the moment, that is all of the questions that we have tonight. As we're kind of wrapping up, and we're seeing if there is another question come through, I'll let you know. But as we're wrapping up, is there anything that you feel is really important for the women on the call to know tonight, kind of as we're ending? And before you answer that, we do have another question. and then we'll get to that last question.
Try to get it in there. Yeah.
She was ready. Thanks, Tara. Tara says, hi, I'm postmenopausal here. She says, I just started the combo cream. What can I expect as far as spotting or bleeding? It hasn't happened yet, but I had to put the patch in the past because of it. And if it does happen with the cream, what do you do to stop it? Or how long can I expect it to happen before my body adjusts? She says, I'm going on vacation in June. LOL.
Gotcha. So we don't want any spotting lady on vacation. That's your goal in that sentence. Yeah, it doesn't happen for every woman. It can be something that's unloving experience when we first start hormone therapy, especially if you've gone that full year without a period and you're postmenopausal and in your 50s. When you first start hormone therapy, if you haven't started before, you can experience some spotting that might be irregular because your body's going to respond to the hormones a little bit. Like your uterus is going to respond to them a little bit, but it's usually very transitory, usually in the first month or two. For most women, it'll get better on its own, and there's not something specific they need to do about it. But hopefully, it won't happen. It doesn't happen to every patient. And for those women that were starting hormone therapy earlier, like if you're still having your period, if you're still menstruating regularly or irregularly in perimenopause, the hormone therapy is really not going to change that head. It's not going to solve it. Some women notice that their periods might get a little bit nicer, lighter, a little bit more manageable, but it's not going to stop your period. It's not going to restart a period if you haven't had one in a year. But it's just sometimes you can get that a little bit of irregular spotting. And it's more of an annoyance than anything. It shouldn't be anything that would interfere with your vacation. You should be able to swimming, wearing bathing suits, and sexy, all the fun stuff. The vacation should bring.
There you go. I think we're all crossing our fingers for a vacation like that. Like, that sounds great. Well, I think that was our last question. So swinging back around to that last question, do you feel like there's anything, Dr. Kat, that the women on this call should know, just in general as we're wrapping up tonight?
I really think that my biggest push is to really have women learn as much as they can about their bodies, right?
Yeah.
Make sure that you are an advocate for yourself and make sure that you listen to what's happening to your body. You're the expert of your body because you're the one who's living in it, and you only get this one body, so you have to do everything you can to take care of it. And that may or may not include muscle therapy, that it should include you being thoughtful about what it is that you're putting in your body and how you want to feel and how you want to show up in your life. And so part of this is like learning about what's happening, dive deep in learning more about this process, read about perimenopause and menopause. We have a lot of good resources on our website that are really well written educational articles about any topic or any symptom you can either imagine. And if we could even possibly list a comprehensive list of all the symptoms that supplement experience. But I just encourage women to get out there and learn as much as they can, because it's only when you build that knowledge that then you're able to advocate for yourself, really tell what's going on, and also to be able to have better and get help for yourself as well, and to help the other women around you too. Also, don't gatekeep this information. If you learned something good tonight and you opened some questions that were really helpful, share the information about these webinars with friends, family members, whatever. And our past webinars have been turned into podcasts that you can listen to in the car. You can replay these webinars as well. So there's lots of resources at your fingertips that are available that are free for you to use. So take advantage of everything. So what should you think about this?
Absolutely. Yeah. Thank you, Dr. Kat, for those last words. I think those are so important to kind of remember. And yeah, I love that you also were highlighting like the resources that Winona has. I think those are so helpful. And then, yeah, also just a reminder to everyone who's here that if you are a Winona patient, or if you become a Winona patient, that your Winona doctor is available also 24/7 in your portal to ask these kind of questions to all the time. So if you do have any of these questions, just shoot that question over to them, or you can come to, I was telling everyone at the beginning, I was like, a little secret about these is that you can actually come to as many of these as you want. You don't just have to come to one. You can come every month if you want. So I do hope that I'll see some of you all at our next one. Next month we have a live Q&A, and then we also have a doctor dialogue, which is super exciting. Our doctor dialogues we have Dr. Kat, and then we have a special expert guest kind of join, and we're usually talking on a topic kind of that we dive into that, and then we'll also have some Q&A. So you'll get your questions answered, but you also get some special insight into whatever topic that month's doctor dialogue is about. But thank you everyone so much for coming tonight, for taking the time out of your schedule. I know it can be hard to find that time, so we know that is a huge thing, and we're so glad that you took the time just to put yourself first for a little bit and kind of ask these questions. But thank you everyone for coming tonight. Dr. Kat, thank you so much for your time. Absolutely. And hopefully we will catch everyone next time.
All right. Have a good night, ladies.
Good night, everyone. Bye.
Thanks for spending time with us. We hope today's conversation helped you feel more informed, more supported, and a lot less alone. If you're ready to go deeper, download the Winona app. It's free, it's for you, and it's filled with resources, real stories, expert insights, and a vibrant space to connect with women navigating the same season. Have questions? Join our next live Q&A. Until next time, take care of yourself. We'll be here when you're ready for more.